Today, we're going to cover accelerating digital pathology within your organization. I am a principal solutions architect. My name is Andrew Mitchell. I've been with Iron Mountain for 11 years. I primarily work with digital pathology solutions and digital transformation using artificial intelligence and machine learning. With me on today's presentation, I have Matthew Comerford, who has spent 15 years with packaging and positioning enterprise products. He is Iron Mountain's Director of Pricing and Products Management. Today, we're going to cover an overview of digital pathology, why the industry is moving to digital images, its cost effectiveness, and the return on investment. We're also going to be covering how we meet the need to scale, next steps, and where you can learn more about digital pathology on demand. The digital pathology section has a broad definition of what digital pathology is. It covers anything from healthcare applications that include diagnostic consultation and intraoperative diagnosis, all the way to decision and peer review tumor boards. Specifically, Iron Mountain is supporting digital pathology in the following way. Our imaging professionals scan glass slides to create whole slide images that can be securely viewed and analyzed and stored. At this time, research studies are validating that the approach of using whole slide digital images is comparable to looking at a glass slide under a microscope. Instead of viewing a glass slide under a microscope, pathologists can examine a high-resolution image on a screen. The solution further supports pathologists with tools for measurements, analysis, pattern recognition, and annotation. A major advantage of the digital approach is that images can be made available to a specialist or to other pathologists for a second opinion. We believe that digital pathology will bring advantages to the industry. We expect to reduce risk and costs. Going digital will reduce the transportation of glass slides and reduce the risk for breakage. The solution also leverages resilient cloud storage and eliminates digital storage risks that you can often find in the cloud. We reduce resource shortages. There is a worldwide shortage of pathologists, even in North America. Digital delivery sites provide an opportunity for remote diagnosis where pathologists are in extremely short supply. We improve collaboration. This is something that we're very excited about. Digital delivery means that an image can be instantly shared with colleagues. The challenge of shipping fragile glass is eliminated, as well as delay related to waiting for the slides to arrive. And we'll get into a little bit of detail about that a bit later on. We also enable time taken through automation. This can be accomplished through the integration of metadata from laboratory information systems, for example, or automating manual workflows. We also expect to support higher quality results. Artificial intelligence and machine learning, which I'll sometimes refer to as AI/ML, these revolutions support pattern and anomaly recognition and are providing assisted diagnosis at this time. So doctors, lab managers, and healthcare execs recognize the digital pathology's advantages. There are operational benefits of efficiency, accuracy, and risk reduction. And there's a broader benefit of innovation. For example, preparing your organization to stay competitive in the future when AI and automation and real-time collaboration will be expected. This is coming at us very quickly. We expect AI to make a huge impact in the healthcare space. We have identified 6 main areas that we expect to see day-to-day impact, reduce risk. As I said a bit earlier, digital pathology will reduce transportation-related risk, especially breakage. Iron Mountain further reduces the risk with highly resilient cloud storage to make sure that data is never lost. We also help keep staff focused on important healthcare activities. Most healthcare organizations aren't in the business of digitization or maintaining the infrastructure to make it happen. Iron Mountain very specifically is. This is kind of our bread and butter. Auditable chain of custody. This is another thing that is right in our wheelhouse. Iron Mountain tracks every action, transportation, storage, imaging, digital image movement to the cloud, who accesses images, and when they access them. Improved accessibility. Digital pathology slides are always available to authorized users. Iron Mountain also can deliver the physical slides if and when needed. So although we're doing the digitization work, we can still get that physical slide to you if needed. Enhanced diagnosis. AI and machine learning algorithms are able to enumerate cells, spot patterns to give pathologists an assist in drawing their conclusions. And then secure collaboration. Securely sharing high-resolution digital slide is days, or in some cases weeks faster than sharing the actual glass slide. As you can tell by now, our aim is to support the science and business of pathology. The World Economic Forum expects technologies like AI and ML will help transform global health outcomes by improving data analysis, medical diagnosis, and healthcare delivery in multiple domains. With respect to pathology, predictive AI models are expected to support disease detection, research, prevention, and guide doctors in creating patient treatment plans. AI will also help automate mundane tasks and make workflows run more efficiently. With respect specifically to increased efficiency, AI and ML will increasingly take over repetitive, routine, and time-consuming tasks, including image annotation and data organization. You can think about things like identifying and quantifying cell count, shape, distribution of tissue samples. Removing this type of workload with AI algorithms is leading to higher accuracy for these types of tasks. Enhanced quality. AI algorithms can analyze amounts of data beyond human capability with high levels of precision. This ability can assist pathologists in working with patient records and other large data sets. In addition to efficiency gains, the algorithmic capability helps pathologists detect patterns and anomalies such as rare subtypes or unusual features. In one recent study, AI showed promise in refining the pathologist's work on tumor grading. The algorithm returned more consistent scoring than the studies for participating pathologists. To paraphrase the Journal of Clinical Pathology, the deployment of computational pathology, including AI tools, is considered a paradigm shift, which makes pathology services more efficient and ideally more accessible in remote communities or in countries where pathologists are truly in short supply. Collaboration, the expectation of fostering collaboration by enabling the ability to share a slide will achieve better results for patients. 8 seconds are live when needed without the burden of shipping the physical slide. So if you think about it, digital image can be delivered instantly, where a slide has to be packaged itself. Medical and educational workflows. The investment in digital pathology helps support education and clinical care, according to recent studies. At this point, I'm going to hand it over to Matthew to cover a couple slides.
Thanks, Andrew. Now I'll drill into the topic of cost effectiveness. What exactly does efficiency look like for pathologists? Digital pathology systems have been validated by research published in the Modern Pathology Journal for their ability to reduce case backlogs, ease collaboration with peers, and speed preparation times for tumor boards. A digital approach also allows remote work to support geographic challenges and avoid unnecessary trips to the lab. Some of the key efficiency gains include access for remote sign-out as needed, an AI-enhanced method to review and render diagnoses, broaden clinical expertise through worldwide collaboration opportunities, and scalable digital management of slides that can make data accessible and keep patient information secure. Moving to the lens of lab managers, we can look at efficiency in the following terms. Digital pathology drives faster case turnover and therefore increased productivity and volume of work. This is based on research from experts from the Diagnostic and Research Institute of Pathology in Austria. It also reduces cost by cutting time with histology techs that must spend time prepping slides and making duplicates. Documented efficiency gains include fewer courier charges, as digital files are available immediately, more affordable storage options including off-site vaults and tier levels, reduced labor costs in the lab as processes no longer require duplication and mundane tasks can be automated. And finally, the ability to reuse images, saving hours of unnecessary labor. Now we can scale this efficiency to healthcare organizations. Digital pathology allows physicians, educators, and medical students to make massive leaps in speed, accuracy, and collaboration. The tangible benefits for healthcare organization as a whole come in the form of improved patient care as well as business value. Documented efficiency gains include consolidation of smaller, disparate histology labs into larger centralized labs, avoiding treatment costs due to reduced rates of interpretive errors, and loss avoidance since properly managed scanned images cannot be lost or broken. Last, we have the removal of image quality control burden with an outsourced and comprehensive solutions. The sources on these points come from the Journal of Pathology, Informatics, and Frontiers of Medicine. Pioneering ROI case study. In a crucible study, the pathology department at Memorial Sloan Kettering Cancer Center's digital pathology operation showed a noteworthy decrease in efficiency and operational utility. Comparative cost analysis showed a USD 1.3 million in savings over 5 years and a 1-day decrease in turnaround time. In a related digital pathology experience survey, 80% of respondents reported improved clinical sign-out using whole slide images. Researchers also noted a 5-year digital pathology cost analysis from the University of Pittsburgh Medical Center that projected an overall USD 17.7 million savings across their large-size distributed health network. Benchmark data and metrics can be applied to any organization to gauge the impact of digital pathology deployments. Returns on investment can be calculated by a reduction in glass slide request as whole slide images become available. The decrease in confirmatory testing for patients with metastatic recurrent disease, the long-term decrease in off-site pathology asset costs, and faster turnaround times throughout the pathology workflow. Main takeaway, the ROI is impressive, but it's vital to note that a digital pathology practice implemented in-house requires large investments in capital, training, physical resources, and time. That investment only becomes lucrative after a faraway time horizon. Organizations can rapidly access the benefits of large-scale deployment by partnering with a capable and reputable as-a-service provider to meet the scalable volume of scanning, storage, and access needs.
So digital pathology is going mainstream, but adopting the technology faces some key barriers, such as the volume of slides. Inconsistent or fast-growing volumes of slides create scale and staffing issues for most of our customers. Equipment and infrastructure, advanced slide scanners are extraordinarily expensive. Often overlooked is the associated costs with the IT infrastructure and storage costs that go with those scanners. That is often something that just isn't grasped until it's too late in some cases and can really explode the cost of establishing a digital pathology infrastructure. Floor space is at a premium at most healthcare facilities. Slide scanning storage shouldn't take up a lot of space. We have multiple customers who have transitioned their physical sites to us, and they've sourced quite a bit of floor space. One of our customers is even considering being able to expand their dialysis clinic because they can move their slides offsite to us and shift to digital delivery. Using an as-a-service model enables organizations to focus on high-resolution digital image delivery and not the act of scanning. So how do we provide those? So we provided predictable costs. Customers pay a predictable by-the-slide rate for scanning and for gigabyte digital storage. Low upfront investment. The investment is agreed upon the volume of slides for imaging with billing that matches the pay-as-you-go model. There are no multi-million-dollar day-one investments to be made with the as-a-service model. The usage is also scalable. The Iron Mountain solution is architected to scale up with your needs, whether that need is for millions of retrospective slides or a couple of thousand prospective slides each month. We can take on your project. Accessibility. Our digital pathology solution is locked down. It is secure. We do recognize that this is protected health information, and only authorized users can access content. As discussed, we enable collaboration, but that collaboration is secure. Customization. If you need something special, just ask us. Customization example could be integrating with your LIS system, collaborating with an existing AI vendor, or delivering an existing pathology platform, delivering to an existing pathology platform. And then cost avoidance. Our solution lets organizations avoid associated costs such as staffing and IT support, compliance risk, as well as data security issues. This slide gives an at-a-glance illustration of the differences between Iron Mountain's digital pathology on-demand solution versus how requests for digital delivery have been done. So it's kind of at a high level. So with digital pathology, a request for an exception or exceptions is made through our secure portal. An Iron Mountain specialist will then retrieve the exception and prep the slides for imaging and present the slide to the imaging system for scanning. Once scanned, the image will be quality checked. If there is an issue, a slide will be re-imaged. If it passes, the digital image will be released to the defined location for the pathologist to review. This workflow typically takes 24 hours from the point of the initial request to the time of completion. In contrast to the movement of the physical slides is the much more time-consuming and probably somewhat familiar to you. Instead of 1 day, the physical workflow could take up to 3 to 5 days and potentially longer. Most of that time being taken up by logistics, transportation, and so forth. As we presented, the solution is designed to improve collaboration and operational efficiency. Solution converts glass slides to whole slide digital images captures the metadata, and even links to the patient's medical record. We provide role-based access. Only the users with proper credentials can access digital content. Encryption, all content is encrypted in transit and at rest. Security and scalability, all content is secured in iron cloud storage, which is architected for data resiliency. Time saving, we deliver digital images and it saves time over the physical delivery of the slides, as we just discussed. Collaboration, we almost can't say enough about this. This is a key enhancement that's provided by digital pathology that we hope will improve patient outcomes. From storage, we can maintain the physical slides just as easily as we can maintain the digital content. Digital pathology removed the need to consume precious floor space for slide storage or maintain racks of IT equipment for digital storage. So what's next? Iron Mountain can help healthcare organizations of all sizes achieve digital pathology implementation scale. We help over 2,000 healthcare customers and the top 10 global pharmaceutical companies in the world. The services we provide are through 24 imaging centers that digitize more than 1.5 billion documents annually. Iron Mountain also maintains 850 million patient records, over 1 billion medical images, and more than 1 billion pathology slides in its secure storage facility. The as-a-service model is emerging just in time to fill the gap between the need to adopt digital pathology systems for narrow use cases and the potential need to scale using in-house resources. Additional recommendations that have arisen from customer discussion include exploring funding opportunities, grants, partnerships with organizations that can support telemedicine initiatives, along with cost-sharing models or cloud-based solutions to reduce initial investment. Healthcare organizations can also work with local governments, other healthcare networks, and technology providers to improve infrastructure, such as broadband connectivity and reliable power supply. Thank you for your time today. Please visit ironmountain.com, digital-pathology for more information, or contact your Iron Mountain rep.